Hello guys, today I want to look at cholera, also known as vibrio cholerae. Okay, hope you stay with me to the end. We'll look at the definition, the causes, signs and symptoms, pathophysiology, and nursing management, as well as medical management. And at the end, we'll also look at some preventive measures. So please stay with me until the end. Okay. So to begin with, we have a question here. Define cholera, state the causes of cholera, mention the characteristics of vibrio cholerae, then pathophysiology. Okay, now you remember with the condition cholera, this patient may come in with profuse diarrhea and profuse vomiting. Okay, so this condition is an emergency. Whenever you see cholera, this patient, you need to nurse them in an emergency way. Okay. Then other questions, we have state signs and symptoms of cholera. Then explain the management of cholera, the preventive measures, the complications. Okay. Yeah. So we can dive in. So our definition: cholera is an acute infectious disease caused by vibrio cholerae, characterized by copious rice water, stool or diarrhea, vomiting, muscle cramps, severe dehydration, and vascular collapse. Okay, so this is our definition. With this definition, you should be able to get 5 marks. Transmission: how is cholera transmitted? So transmission of cholera is via the fecal-oral route. So if someone comes in contact with fecal matter that is infected with cholera bacteria, okay, they are going to get this condition either by not washing hands, or coming in contact with food that is contaminated with fecal matter that has the vibrio cholerae in it, or you are eating with unwashed hands and all that. The incubation period is about 5 days, or a few hours to 5 days. So if you get in contact with the vibrio cholerae today, within a few hours, the signs and symptoms such as vomiting and diarrhea will start showing. Or if let's say your immunity is quite strong, you might start maybe getting the symptoms after 5 days. Okay. Causative organism, there are 2 biotypes. This is vibrio, the classical vibrio cholerae, and hemolytic L-ata vibria. Okay, so those are the causative organisms. Then characteristics of this vibrio cholerae bacteria: it is comma shaped. Okay, then it is aerobic, and then gram negative, non-spore forming bacteria. Okay, then other characteristic: it is mobile. It is motile. It's able to move. It has a flagella. Okay, then it is killed with heat of about 55 degrees for about 15 minutes. So for example, if you boil your water and your water is contaminated, as long as the temperature goes above 55 degrees Celsius, okay, and you boil that water for more than 15 minutes, the bacteria is going to die. Okay, then can survive in aquatic environments for extended period in a dormant state. So it can stay dormant such that if someone comes in contact with that water, okay, or that environment where the vibrio was maybe disposed of, the patient or the person in that environment can still get that infection. Okay. Then pathophysiology. So vibrio cholerae remains in the gut after ingestion. So if someone comes in contact with this via the fecal-oral route, it will go through the digestive system. Now, if it passes through the stomach, okay, it might be destroyed and you might not get the condition. But once it escapes the acidic environment of the stomach, it will escape and go into the small intestines. Now, in the small intestines, it does not penetrate into the bloodstream. It will be adherent. It will remain, okay, adhering to the mucosa in the small intestines. So when it adheres to the mucosa in the small intestines of the membrane proteins, then it starts secreting toxins. Okay, so the vibrio cholerae produces enterotoxins. So these toxins will now bind to the intestinal lumen, okay, which will lead to start secretion of chloride and water into the lumen. So it will cause sodium and water secretion from the body into the intestines, resulting in a fluid accumulation in the stomach. So now this will cause dehydration in the body. Okay. Then sodium and chloride absorption is also inhibited, and therefore resulting in water and sodium as well as potassium and bicarbonate loss from the body. So this is what is going to cause the diarrhea, okay, the watery diarrhea and the vomiting, okay, because of the accumulation of fluids in the intestines. Then the signs and symptoms, we have mild to acute onset of diarrhea, okay, in the evacuation phase. So this is the first phase. Once the signs and symptoms start to show, you have mild to moderate, so mild to acute onset of diarrhea, which initially contains fecal matter, but then after some time, because of increased watery secretion, osmotic diarrhea, the diarrhea becomes flaky. Okay, this is now described as the rice water stew. That is a characteristic you can say sign in cholera. Okay, then you have projectile vomiting. Now the projectile vomiting, it is believed that the vibrio cholerae will cause a type of reverse peristalsis. So this is what is going to cause the projectile vomiting. Then the patient will also have severe dehydration due to the diarrhea that they have and vomiting. Okay. Then after evacuation phase, they go into a collapse phase. Now collapse meaning they have lost a lot of fluids. So here you have muscle cramps due to electrolyte loss, metabolic acidosis. Okay, this one is also due to electrolyte imbalance. It can be accompanied by signs of air hunger, as well as deep and shallow, as well as rapid respirations. Okay, then someone may go into hypovolemic shock. Now the shock is a result of depletion of fluids, and then someone may also go into vascular collapse, so the circulation may collapse because of the fluids that are being lost. Okay. Other signs, if not treated early, the patient may go into renal failure, and if possible, they might even die from that. In recovery phase, the patient might improve with the signs and symptoms starting to decline. Okay. Then the management. So just run through the management. The aims of management: to control fluid and electrolyte imbalance, to eliminate the causative organism, to prevent the spread of infections to others, as well as to prevent complications. Okay. So with this, you can with history of projectile vomiting as well as profuse diarrhea, then physical examination, you might see dehydration. The patient might present with poor skin tagger because of the increased fluid loss. Then on diagnosis, for laboratory testing, you can check the stool. Okay, this is by the use of dark ground microscopy. Okay, so this will try and identify the vibrio cholerae. Then stool and vomiters can also be checked, as well as rectal swab, to identify the causative organism. Then immunofluorescent may also allow for definitive diagnosis of the vibrio cholerae. Okay. Then for emergency, here we need to correct fluids. Okay, remember, if someone has got cholera, they are losing water, and by the end of the day, if the fluids are not replaced, this patient might die. So I'll just try and run through the management, hoping you'll be with me up to the end. Okay, so you're going to give Ringer's lactate as one of the fluids you're going to give via IV fluid. Okay, so with this one, apart from fluid, before you start giving your fluid replacement, you need to make sure that you give a large bore cannula, if possible on both sides of the hands, okay, on the left and on the right, so that fluids are running concurrently. You have maybe normal saline on this side and as well as Ringer's lactate. Okay, and if possible, if you're able to tolerate, you can also give ORS, oral rehydration salts. Okay, so you give 30 ml per kg body weight in the first 30 minutes. Okay, IV. Then you continue 70 ml per kg after that in 2 hours, and so on. Okay, then you continue rehydrating while you're checking the BP and the pulse to see if they are going to get back to normal. Okay, then after that, the patient can also drink other fluids, 5 ml per kg as tolerated. Okay, if they're able to tolerate within the hour, they can also take orally. Then monitor vitals every 30 minutes. Remember, this patient may go into circulatory collapse, so you should, as you are giving your fluids, you are also checking vitals to see if they're improving or not. Okay, then if signs of circulatory overload are detected, slow down the rate of flow. So try and reduce the input so that you monitor, because this can also be another problem. Okay, then you can also give ORS as soon as the patient is able to drink, so that you maintain the fluid input as well as the output. Okay, then for drug, the drug of choice for cholera is doxycycline 300 milligrams stat. Okay, so this one is the drug of choice. Give it as the patient just comes in. Okay, then tetracycline you can also give. These are other supportive drugs. Tetracycline 500 milligrams 4 times a day. Cotrimoxazole, ciprofloxacin, okay, erythromycin. These are other supportive drugs. So the main drug of choice is doxy. Then our nursing management: to rehydrate the patient, to prevent the spread of the disease, to treat the infection. Okay. Under environment, so the patient will be nursed in cholera center established. Then the rooms are swept and disinfected whenever need arises. So this one, they have to be nursed in a cholera center or in isolation. Yeah. Okay. Then rehydration continues with this one. So you need to give a 21G cannula. So this one is big enough so that fluids are able to flow as quickly as possible. Okay. Then as the patient improves, you can switch to oral rehydration, or you can add other methods. You can still add the IV as well as the orals. Okay, so that's just an example of a 21G cannula. Okay. Then for observations, you need to make sure that you observe this patient closely. Okay, so patient might be nursed away from others in order to prevent the spread of infection. Then the room must be well ventilated, proper circulation and all that. Okay, then see that the patient's condition. One must be nursed near a toilet. If the toilet is too far, you may make a hole on the bed, okay, and put a basin under. This is what is called a commode. This where you prevent the patient from straining, because these patients have diarrhea that is almost continuous, so they can't walk long distances to a toilet. So it's better you put a bucket or something, okay, where they can defecate, they can pass their stool as quickly as possible for their own convenience. Okay. Then the patient's condition should be checked regularly. Monitor the vital signs as you are giving the fluids, to see if the patient is improving or the patient is not improving. So you check the pulse, the blood pressure, respirations, and all that, as well as the temperature. Remember with this one, because the vibrio cholerae does not go in the bloodstream, okay, there is no high temperature, so this patient might go into hypothermia. Okay, so you check the temperature to prevent it from going way below maybe the normal body temperature. Okay, then observe the patient's quality and amount of stool as passed. So you also want to see if the stool, the quality of stool is improving or it is not improving. It's maybe the same and all that, meaning that the treatment is not working. So you check for that. Then you also watch for signs of dehydration, such as skin tag or elasticity of the skin, any sunken eyes, and all those dry mucous membranes. Okay, so on infection prevention, remember isolation. Here you can isolate the patient to prevent the spread of infection to others. That is, for example, if they're not in a cholera center, for example, where there are other cholera patients and you have maybe the first case in a facility or health care center, you can isolate this patient because cholera is very highly contagious to others. Okay, then health workers should also wear protective clothing to prevent the spread of infection to themselves as well as to others. So, and then here you should also minimize any visitors. Okay. Then the linen should be whatever linen, whether it's blankets, whether it's the mattress, whether it's whatever that the patient is using, must be disinfected with high level of disinfection. So this is where you wash, you put in soap if possible, you even put in jig, and then you sterilize. Okay, if possible you just throw away and burn those, because the possibility of transmitting the infection to others is very high with cholera. Okay, then under nutrition, you should make sure that you give fluids. Okay, any fluids that the patient can tolerate, you give, as well as if you give, for example, you can give energy fluids like ringers to try and replace the energy, or to give the energy to the patient. If they can tolerate oral, that's good. If they can't, you can continue with the IV fluids. Okay. Then hygiene, this one is very strict. You need to be very strict on hygiene. So here the patient's soiled linen should be treated, should be disinfected with jig, if possible chlorine and any other strong substances that can try and kill the bacteria. Okay, then oral care can also be given if the patient is not vomiting, okay, to prevent halitosis as well as improve the patient's appetite. Okay, so with the psychological care, you should also be able to give psychological care to the patient about the condition and how it can be treated, and to prevent them from feeling neglected. Okay, explain the condition to the patient, the signs and symptoms, and the preventive measures, as well as why you are isolating this patient. All this we want to do to allay anxiety. Okay, now in relation to elimination, you should be able to observe the intake of fluids, okay, or the vomiting, how much they are vomiting, if they are improving or not, how much they are eliminating, as well as the consistency and the type of stool that this patient is eliminating. You want to see if the patient is improving or not. Then also provide a bedpan in the early stages, in the evacuation or in the collapse phase. Then if the patient improves, you can advise them to continue going to the toilet. Okay, then treatment, you can give ORS, then give any other drugs that you can resuscitate the patient with. Then you should make sure that you follow the 5 rights as well. Okay, the right drug, the right route, the right patient, the right okay, we know the rights. So try to make sure that those rights are followed as you are giving your medication. All this is to improve recovery and prevent any complication. Okay, then continue hydration of the patient until the patient's blood pressure improves. Then what are the preventive measures of cholera? Number 1, improve water supply and sanitation. So these people in this community, okay, should make sure that they improve the water. For example, they should stop maybe getting water from the rivers, because that water, you might not know who has defecated in that water. So it's better maybe you put up a borehole. Okay, you may get water from underground, and then if possible you can put up pipes, okay, tap water, which can be boiled of course after that. Okay, then proper food handling. These people, whoever, maybe the people who are selling on the street, they should be able to adhere to proper food handling measures. If it is at home, the people who are preparing food, for example, should be able to wash their hands thoroughly with running water and soap before handling food. And if the food, maybe it's the food that is contaminated, for example, they should be able to wash their food thoroughly before eating it. Okay, and then cook it thoroughly as well, so that of course not but to an extent where the nutrients are lost. Cook it in such a way that the bacteria is treated, okay, is killed. Then cook food well, keep it covered as well to prevent any flies, because these flies might transmit the infection of the food, and then if you eat that food you'll get the bacteria, the contamination or the infection. Okay, then wash the utensils with soap and water. All water used for drinking, washing or cooking should be sterilized. Okay, then boiling water or adding of full chlorine to prevent the bacteria and to kill the bacteria. Then proper disposal of waste. So any waste that you produce, okay, let it be disposed of. Then avoid open air defecation. Open air defecation is where you just defecate maybe in the bush. Okay, so avoid that, because you might find that flies might go on that the fecal matter that has been disposed, and if that fecal matter it has got cholera, it will go and sit on the food and all that. Okay, sometimes even the same open air defecation, if it is done maybe in the river and all that, those people who are going to fetch that water from that river, the infection cycle will continue. Okay, then dispose of children's feces in the toilet, throwing soiled diaper in a pit latrine. Don't just throw a soiled diaper just on a rubbish pit or something like that. It's better it is incinerated, okay, than just throwing it in open air. Then avoid and then use ventilated improved pit latrine. Okay, not those where you don't have any ventilation. Okay, so that is a ventilated improved pit latrine. That is a latrine that has a vent, meaning it helps the air to escape, okay, from the pit latrine, rather than having the air just circulating inside the latrine. Okay, then other preventive measures: early treatment and contact tracing. This one is very important, because when you have a case, you are suspecting a case of cholera, there could be an outbreak where this patient or this person is coming from. So make sure that the last person they were in contact with is treated. Then when that person comes, they should also get the last contact, so that every person in that area is treated. Okay, so make sure that you treat any cases adequately. Then active reporting, making sure that these patients, okay, or these areas where you might find maybe the incidence of cholera is more prevalent than other areas, you might put up a reporting system where if there's a case, maybe at the health center will notify maybe the country or the province, okay, so that there's adequate containment of this disease to prevent it from spreading. Okay, then all materials, whatever, whether it is beddings, mattresses, clothing, whatever the patient is using, okay, these should be sterilized, okay, if possible using chlorine or bleach or whatever, to prevent the spread of infection to others who might use those beddings. Okay, then personal protective equipment. So the people who are treating these patients who have cholera, they should always wear protective equipment, okay, or protective wear. They should make sure that they protect themselves because they can easily get the infection. Okay, if possible, you burn the PPE after it is used. Okay, make sure it is not used again because there's a possibility of getting infected if it is used again. So that is an example of where you clothe, you completely cover yourself, then after that you burn. Okay, then personal hygiene is also important. So here it's personal, here where you wash your hands, you boil water, eat food that has been warmed, okay, and cooked properly, so toilet or a pit latrine. Then postpone any festivals and gatherings. If there are birthdays, if there are kitchen parties, if there are whatever social gathering, in case there's a cholera outbreak, you need to postpone or cancel these gatherings because there is a possibility of increasing the spread of infections in such gatherings. Okay, then anyone that touches cholera patients or clothing should thoroughly be sterilized, okay, because this patient is at risk of spread of that infection. Okay, so now what are the complications of cholera? So the complications this patient might have paralytic ileus, okay, then muscle cramping because they've lost a lot of electrolytes, cardiac arrhythmias because of potassium which they have lost, renal failure due to severe dehydration. They might also have malnutrition because they are losing a lot of nutrients. Okay, yeah. Please subscribe and share to others so that others can also learn. And thank you to all those that have subscribed. Okay, I hope this has helped, and I hope you'll be able to learn something. If there are any questions, please leave them in the description box. Thank you very much.